Which of the following best defines a modifier in medical coding? A. A code that replaces the primary code. B. A two-digit code that provides additional information about a procedure. C. A code that identifies the patient's diagnosis. D. A code used exclusively for insurance claims. Answer: B. Modifiers are two-digit codes appended to CPT or HCPCS codes to provide additional information about a service or procedure, such as laterality, multiple procedures, or unusual circumstances. In ICD-10-CM coding, what does the fifth character typically represent? A. The primary diagnosis. B. The anatomical location or type of complication. C. The patient's age. D. The procedure performed. Answer: B. In ICD-10-CM, the fifth character often specifies additional details such as anatomical site, severity, or type of complication, depending on the chapter. A patient receives a colonoscopy with a biopsy. How should this be coded? A. Only the colonoscopy CPT code. B. Only the biopsy CPT code. C. Both colonoscopy and biopsy CPT codes with appropriate modifier. D. Diagnostic code only. Answer: C. Both procedures are reported separately using CPT codes. Modifiers may be required to indicate that multiple procedures were performed during the same session. Which CPT code section includes immunization administration? A. Surgery. B. Evaluation and management. C. Medicine. D. Radiology. Answer: C. Immunization administration is categorized under the medicine section in CPT, distinct from the vaccine product code. Which scenario requires the use of CPT modifier 59? A. A procedure performed on a different day. B. A procedure performed by a different provider. C. Distinct procedural service performed on the same day or session. D. Procedure discontinued midway. Answer: C. Modifier 59 indicates that a procedure is distinct or independent from other services performed on the same day, clarifying coding for payers. In ICD-10-CM, how is laterality indicated? A. With a seventh character. B. With a fifth or sixth character depending on the code. C. With the first character. D. Laterality is not indicated in ICD-10-CM. Answer: B. Many ICD-10-CM codes use the fifth or sixth character to specify left, right, or bilateral involvement of a body part. A patient is seen for a preventive visit with no complaints. Which CPT code category is appropriate? A. Evaluation and management, established patient. B. Preventive medicine services. C. Surgery. D. Pathology and laboratory. Answer: B. Preventive visits are reported using the preventive medicine CPT codes, which differ from standard E/M codes for problem-focused visits. When using HCPCS Level II codes, which types of services are commonly reported? A. Inpatient surgeries. B. Durable medical equipment, prosthetics, and supplies. C. Physical therapy evaluations. D. Laboratory tests. Answer: B. HCPCS Level II codes are used primarily for billing medical equipment, prosthetics, supplies, and certain medications not included in CPT. What is the main purpose of a comorbidity in coding? A. To determine diagnosis-related groups, DRGs, and impact reimbursement. B. To identify the primary procedure. C. To report unrelated conditions. D. To track laboratory tests. Answer: A. Comorbidities are secondary conditions that influence patient care complexity and affect DRG assignment for inpatient billing. Which of the following is the first step in the medical coding process? A. Assigning CPT codes. B. Reviewing the patient encounter documentation. C. Entering codes into the billing system. D. Calculating reimbursement. Answer B. The coder must first thoroughly review the documentation to understand the patient's diagnoses, procedures, and services before assigning appropriate codes. A patient is admitted for heart failure and develops acute kidney injury during hospitalization. How should this be coded? A. Only heart failure. B. Heart failure as primary, acute kidney injury as secondary. C. Only acute kidney injury. D. Separate admissions must be coded. Answer B. The primary reason for admission is coded first. Any complications or comorbidities that arise during hospitalization are coded as secondary to reflect resource use and severity. In CPT, which service is considered bundled and not reported separately? A. EKG performed with an office visit for chest pain. B. Blood pressure measurement. C. Immunization administration. D. Allergy testing. Answer B. Routine services such as vital signs are included in the E/M code and not reported separately. Only distinct services require separate coding. Which CPT category is used for unlisted procedures? A. Category I. B. Category 2. C. Category 3. D. HCPCS Level II. Answer C. Category 3 CPT codes are temporary codes for emerging or experimental procedures, and unlisted procedures are reported with unlisted Category I codes when no specific code exists. A physician performs a preventive service and addresses an acute minor illness in the same visit. How is coding determined? A. Only preventive service. B. Only the problem-focused visit. C. Both codes with appropriate modifier. D. Neither service. Answer C. Both services are reported separately. A modifier, usually 25, is used to indicate that a significant, separately identifiable service was performed in addition to the preventive visit. Which type of insurance claim uses ICD-10-CM for diagnosis and CPT for procedures? A. Workers' compensation. B. Medical claims for private insurers. C. Dental claims. D. Vision claims. Answer B. Standard medical insurance claims report diagnosis using ICD-10-CM and procedures/services using CPT, enabling accurate reimbursement and compliance. What does DRG stand for, and why is it important? A. Diagnosis-related group, determines inpatient reimbursement. B. Disease-related grading, used for coding severity. C. Diagnostic reporting guide, used for lab tests. D. Drug-related group, used in pharmacy billing. Answer A. DRGs classify inpatient cases into groups that are clinically similar and expected to require similar resources, guiding hospital reimbursement under prospective payment systems. Which of the following is required to support a medical necessity claim? A. Patient demographics. B. Documentation linking diagnosis and procedure. C. Insurance policy number. D. CPT modifier 59. Answer B. Medical necessity is supported by documentation that clearly demonstrates the rationale for performing a service based on the patient's diagnosis and clinical condition. Which HCPCS code is used for oxygen delivery equipment at home? A. E0601. B. 99213. C. 81002. D. 36415. Answer A. HCPCS Level II code E0601 identifies oxygen concentrators for home use, distinguishing durable medical equipment from other services. How should multiple E/M visits on the same day for different problems be coded? A. Only the highest level visit. B. Each visit separately with modifier 25 as appropriate. C. Combined into one code. D. Cannot be billed. Answer B. Each E/M service can be reported separately if the documentation supports a significant, separately identifiable service. Modifier 25 is used to indicate this. A patient undergoes laparoscopic appendectomy converted to open surgery. How is this coded? A. Only laparoscopic code. B. Only open surgery code. C. Open surgery code with modifier indicating conversion. D. Both codes separately. Answer C. The open surgery code is reported, and a modifier may indicate that it was initially laparoscopic but converted due to complications or intraoperative findings.